Hello everyone, welcome to Story Vault YouTube channel. Hope you enjoy the video. Serious. What's your best story about listening to a gut feeling? Story 1. TLDR. Patient came in with gas pain, ended up in ICU for over a month. Listened to my gut, and luckily the patient lived. I'm a nurse and there are a lot of gut feelings kind of stuff, but any that sticks out is this one lady. She was a readmit from 3 days ago. Had laparoscopic surgery, red flag. I get report and I ask about her labs, specifically lactate and procalcitonin, which can indicate sepsis. They never drew one. Okay, weird. Anyways, they say that she is back BC of uncontrolled pain. The doctor came in and told them that is residual gas pain from the surgery. I get her to the floor and she is in a lot of pain. I listen to her stomach for any signs of movement, bowels should be moving, and I hear nothing, red flag. I look at her stomach and see some redness around her surgical site, red flag. I mark the boundaries with marker. The doctor comes in and looks at her stomach and says that it is gas pain from surgery. He puts in some orders and leaves without even looking my way. Few hours later, 5 a.m., I notice that she hasn't urinated, red flag. I ask if she has peed at all, and she said no and that she will try. The tech gets her up to the commode and nothing. Then she starts tanking. Blood pressure in the 70s. I call rapid response. I try to tell her everything that points out sepsis to me. She physically turns away from me to talk on the phone to the doctor. I ask her for labs, and she ignores me. She got an order for a bolus of fluids saying that the patient is just dry and needs fluids. The fluids run through, and she, rapid response, leaves, saying the BP is better. It is in the 80s now. I come back in to recheck, and her BP is now in the 60s. I call rapid again, and luckily I get a different nurse. First one was at the end of her shift, so she left. She comes in and asks me what is going on. I tell her everything I had noticed, and she says that since the BP is unable to be stabilized, the patient will be transferred to ICU. I demand that labs need to be drawn. She agrees, and the patient is transferred. The patient was septic. She was the most sick patient in the ICU for 4 weeks. The redness I had marked turned into full-blown blisters that covered her entire stomach. Her labs came back. Lactate was over 10, less than 1 is normal, and procalcitonin was 34-ish. I can't remember off the top of my head. The patient lived. Always listen to your gut. Comments. I personally would like to thank you for listening to that intuition. Thank you for being a medical professional and listening to those innermost thoughts and intuition. My obstetric gynecology saved my life by listening as you did. I had problems breastfeeding my previous daughters, 4, after they were born. I was able to provide them with that nutrition, but also had to deal with severe mastitis. My doctor informed me that there was a prescription that I could receive after the baby was born that would help my milk to not come in. I was excited to learn I wouldn't have to suffer from breastfeeding this time. Fast forward. I give birth to my 5th daughter. Everything is great. My doctor explains that he doesn't think he should give me the medication to help stop my milk from coming in. I ask why, and he told me it was just a feeling, and to forgive him for telling me he would. The doctor and me decided to bind my breasts to help with the milk coming in. Fast forward 3 days later and I am home. Been home for 2 days. I start having trouble breathing. I think it is because the breast binding might be too tight, so I loosen it. No relief. Nothing helped and it got worse. I was having a horrible time with pain, tightness, and breathing. Couldn't lay down at all. I drive myself to urgent care with new baby. Get seen within 3 minutes due to the fact I was having a hard time breathing. They do the normal blood pressure and heart rate and weight. Decide to do an EKG on me in the room. I'm waiting for results, and about 4 minutes have passed. I see an ambulance pull into the back of this small building with lights and sirens. I think, dang, someone got messed up. No sooner did I think that than the doctor comes back in and said my EKG showed I was in heart failure and I would be going by ambulance to the hospital. Arrive at hospital and am admitted for the next 2 months. Found out I had postpartum cardiomyopathy, congestive heart failure. My heart was only functioning at 11% with 7 beats per minute, and a blood clot in my right lung. I have had many health issues since then and have been on disability due to those issues. My obstetric gynecology was surprised to hear all that had happened. He visited me in the hospital shortly after. He told me that if had he given me the shot to help stop milk production, I would have died due to the high amount of blood clots that happened with that particular medicine, and that he was grateful for listening to his intuition. They found I have a clotting disorder which would have killed me given the shot. I am eternally grateful that my doctor listened to his intuition that day. Had he not, my husband would be a widower with 5 babies. Always listen to your intuition. Thanks again. Thanks for being a nurse that cares and listens. I've been in multiple hospital situations where I didn't feel listened to, and it ended up making the situation worse. Except the last time I was in the hospital, ER. I was terrified and in a lot of pain. I'm 23 but felt like a small child from fear. The doctor kept writing me off with no idea what was wrong, but I had the sweetest nurse who was absolutely younger than me, but her kindness and willingness to listen made me feel so much better. Turned out I had kidney stones, a UTI, and a vomit virus all at the same time. If not for that sweet nurse at 2 a.m., I would have been in tears the whole time. I'm a nurse's kid, and I had to take my cousin to the ER a few years ago. I picked him up from his dorm, and he was pretty out of it from what we thought was dehydration from the flu, but I noticed some small red splotches on his leg. He told me it was from his pant leg rubbing the skin, but something about it just looked off to me. When I got him to the hospital, I kept pointing it out during his exams. Yes, he's dehydrated and has flu-like symptoms, but also look at his leg. When the resident examined him and said he needed to have his attending take a look, I knew it was serious. Turns out it was severe cellulitis that was on its way to becoming septic. He ended up being admitted and stayed for 2 or 3 days. Who knows how long it would have taken the ER to find it if I hadn't pointed out the spots or if I hadn't insisted on being in the triage and exam rooms with him. Always trust your gut. Story 2. In high school, my girlfriend had me come to her youth group, and her youth pastor, who was also a music teacher at our HS who was adored by the community, really didn't sit well with me. I saw him go from 100% praise singing to turning around to his wife and muttering something awful to her with the worst glare I'd ever seen. Only she and I were in his line of sight, then go right back to fake smile singing. I told her he seemed really fake and there was a dark side to him. Turns out he was really into Kitty PR0N and even started buying alcohol for his pupils and inviting them to his house. The church knew, covered it up, and he eventually got arrested for misconduct with a minor, did a quick jail stint, and moved out of state. Story 3. I told this story in the last gut feeling thread, but it's worth reposting. I was a birthday party princess in college. Dress up as a Disney character, sing some songs, help with cake, paint faces, typical party stuff. I get called to a party that began at 8 p.m. Unusual, but not unheard of in our industry. A lot of Spanish-speaking families party well into the night. But I pull up down the street, princesses don't drive, and begin walking to the house, dressed as Sleeping Beauty, my party box of supplies in hand. But when I saw the house, I knew immediately something was wrong. There were no lights on, no cars, no balloons, but against my better judgment, I knocked on the door. This super creepy-looking guy in his mid-50s answers, in a dirty t-shirt and jeans, and the first thing he says is, "The party's around back." I took one look at this guy and booked it as fast as I could while holding a box, wearing a ball gown and being mildly crippled to begin with. I got into my car, locked the doors, floored it to a 7 to 11 and called my boss. The party never called demanding to know where their princess was. No one asked for their deposit back. My boss called police non-emergency, but I don't know if anything was ever done. I'm 100% sure there was no party in that house. Story 4. It happened in the worst way. I was working with a patient whose cancer was in full remission. She looked amazing and was telling me about the trips she and her husband was planning. Paris, Africa, etc. All the places she couldn't go to because of kids, military, and now cancer. But now, with nothing holding her back, she was going to take the world by storm. It hit me, and it hit me hard. As we were setting up her follow-up appointment, she asked me if I was okay. I said gas, and she laughed me off. 1 week later, she died in the hospital. Her cancer returned and in record time, destroyed her to the point that she was bleeding out internally. They were going through so many bags of blood that the commander of the hospital told them to stop. I will never forget the look on her face as she dreamt of the future that I knew would never happen and the feeling it gave me. Comments. I'm so sorry. I had a client that did something similar. She had been our customer for as long as I can remember. Beat cancer, made it through, and was going to finally live her life. It was breast cancer, and she had everything removed. So she goes in a little bit later to have breast implants. Came in the Friday before her surgery, super excited. Tells us all about how she's going to enjoy her new girls over the summer. I'll never forget how happy she looked to have beaten this disease and be getting a new body. Her husband came in 2 weeks later to get his hair cut. When I asked him how she was enjoying her new bikini-ready body, he just broke down and asked, "You didn't hear. X died." Turned out when they were wheeling her from surgery to post-op, someone wasn't doing their job, and she aspirated on vomit from the anesthesia. My heart broke. I'll never forget how happy she was and how one careless nurse/doctor not watching her for a little bit snuffed out a bright light. This hits home for me too. My aunt had always visited me in California throughout my childhood, but for the first time I visited her and her family in Utah for Thanksgiving. Everyone was talking about how overjoyed she was that I was visiting for the first time, and she was talking about all the stuff she had planned after her surgery. Some health issues with her stomach. A few weeks later, when I was home again, we got a call from my cousin crying, saying that her mom had passed. It turned out she'd gotten an infection during the surgery, and the surgeons had overlooked it. What's even crazier is that for years leading up to this, she always said, "I don't mind if I die at age 60. Beyond that, you can't really do much." My mom, being Chinese, would tell her, "Never say that. It'll actually happen." This is a common Chinese superstition. Lo and behold, she died at age 59. So, that's the end of the video. Hit the like button and subscribe. Have a good day and see you in the next video.